I've seen so much bad care about and loose use of testosterone without talking about fertility that I did a secret shopper study. It was published in JAMA. I was just on the Wall Street Journal and interviewed for this. Basically, I pretended to be a male who was interested in testosterone. My testosterone was 675, not to brag, but I also desired future fertility. So obviously not a good candidate for testosterone replacement therapy. 6 of the 7 companies that I went to that were direct to consumer platforms offered me testosterone, and their goals were 50% of them had a goal of 1,000 or higher, which we just said is way too high. And they really just didn't follow our guidelines that I just discussed. So this is concerning. We need to be there for our patients. We need to talk about these things, right? TRT is growing in popularity, and it's going to be something that people are going to ask about. Understanding the proper diagnosis and the risks of TRT is key, especially in fertility. The great news is there's so many things that you can offer your patients, especially if they want to preserve their fertility, to treat with. And then treating low T does not always fix everything, right? I see guys who come in, they're like, "Doc, I feel great. I'm still fat as hell. Why?" I'm like, "And my testosterone is 700. I'm like, "Well, are you eating poorly? You're still not exercising." Like, it's not God's gift to this earth. You still have to put effort in, right? And some people still don't feel good. And there's other things that can cause problems, not just testosterone. And the bottom line is, don't be afraid of it. It's very stigmatized. It's a pretty straightforward thing. And if you have issues, you can always ask for consult, or you can always refer to someone who knows more than you.